This segment is sponsored in part by One Brooklyn Health.
Obesity rates in the city are on the rise, creating big challenges and health risks for New Yorkers. Joining us to talk about bariatric care and who might be the right candidate for this life-changing surgery are Dr. Theodore Hufford and Dr. Katrina Tuya from One Brooklyn Health. Thank you both for being here. We appreciate the time. So talk to us a little bit about how serious of a problem obesity is here in New York City.
Yeah, so obesity is a problem everywhere in the city, everywhere in the country, but also everywhere in the city. Obesity rates in Brooklyn are rising up to 25–30% in some neighborhoods, which obesity isn't the problem itself, it's the medical problems associated with obesity, like high blood pressure, diabetes, sleep apnea, high cholesterol, and even some cancers have been associated with obesity.
Wow, so it's a lot of different circles involved in just one problem. So what, as doctors, can you do to treat obesity?
So we're committed to treating the severely obese population with respect and sensitivity through our bariatric care program. Our goal is to treat them with safe surgical options and basically reduce their health risks and their complications that they can have just from being morbidly obese.
Wow. So, Dr. Hufford, you have a pretty unique perspective on this because you've been on both sides of the process. This is you.
Oh, yeah.
Wow.
Yeah.
How was this your heaviest?
Yeah, that was one of my heaviest pictures for sure.
Okay.
For sure, yeah.
So you bring a unique perspective to this.
Absolutely. So, you know, when I chose to become an obesity specialist and do this kind of work, it wasn't just a professional choice, it was a personal choice for me because of the process that I went through and the things that I had dealt with in my own life. You know, obesity itself isn't the problem. Like I said, it's the medical stuff, right? But also coming along with that is all of the psychological and the mental health and the behavioral stuff that goes along with it. So a lot of patients don't realize that there's these other parts to that. And so dieting, trying every new diet, trying every exercise plan, feeling self-conscious or not comfortable in your own skin. And so what I give back to my patients is to know that when they come to me for what is a professional opinion, they know that it's going to come from a personal place.
Right, which I'm sure goes a very long way.
Absolutely.
So who is the ideal candidate for bariatric surgery?
So there is some criteria for bariatric surgery to qualify for it. We measure the BMI of the patient, which is the body mass index. It's your weight in kilograms divided by your height in meters squared. We normally show our patients a chart in the office because it's not something that most patients know off the bat. But you know, when you go to your primary care physician, it's really important to ask them, like, what is my BMI, so that they know, because anything below 30 is overweight, but not in the morbid obese category. So patients that are 35 to 40 with comorbidities or without are candidates for the surgery, and just somebody that's very committed to weight loss itself.
Right, that's very important to make sure that you ask at when you go for your physical.
Yes.
I just scheduled mine. No, I'm glad you guys are here. Very timely. Is there anything else viewers should know about bariatric care or who might be struggling with obesity?
Absolutely. So, so at our center, we're actually what's considered a nationally accredited center of excellence, which means that we go through a specific verification process that looks at quality metrics, quality measures, like our outcomes that are there. And in order to become a center of excellence, you have to meet certain criteria and provide safe care through continuous quality improvement. And so we do that through a multidisciplinary approach, meaning we have specialists like Dr. Tuya and myself, but also nutritionists, psychologists, psychiatrists, other different support staff that are all specially trained for this specifically. Sure. And so the people that are going to come to see us at our center know for a fact that they're going to get a high quality care with continuous quality improvement, and it's going to be safe and effective.
Very important information. Thank you both so much for your time.
Thanks.
We appreciate it. And to learn more about bariatric care with One Brooklyn Health, scan the QR code on your screen.